Good day, Miss. My name is Baling from BSN2-WIEDENBACH. For today's video, I am going to show you the procedures about nasal instillation. But before that, what is nasal instillation? Nasal instillations are used to treat allergies, sinus infections, and nasal congestion. The nose is normally not a sterile cavity, but because of its connection with the sinuses, medical asepsis should be observed carefully when using nasal instillations. There are three objectives of nasal instillation. Number 1, to instill directly the medication into the nostril or nares. Number 2, to provide means for nasal evaluation. And number 3 is to obtain desired therapeutic effect. Now, let us proceed to the procedures.
Step number 1. Gather equipment and check medication order against the original physician's order according to agency policy. Clarify any inconsistencies and check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Next is to know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. After that, we should perform hand hygiene because hand hygiene prevents the spread of microorganisms. After performing hand hygiene, you can place the medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Next step is to transport the medications to the patient's bedside carefully and keep the medications inside at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medications. After transporting the medications to the patient's bedside, identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name, because identifying the patient ensures the right patient receives the medication and helps prevent errors. Next is to explain the procedures to the patient. Explaining the procedure to the patient gains cooperation and to allay anxiety. Next step is to offer tissue to the patient and ask the patient to blow his or her nose. Blowing the nose clears the nasal mucosa prior to medication administration. After that, have patient sit up with head tilted well back. If patient is lying down, tilt head back over a pillow. These positions allow the solution to flow well back into the nares. Do not tilt head if the patient has a cervical spine injury. Next is to draw sufficient solution into dropper for both nares. Do not return excess solution to a stock bottle. Returning the solution to a stock bottle increases the risk for contamination of the stock bottle. Ask the patient to breathe through the mouth and hold tip of the nose and place dropper just above nares, about 1/3 of an inch. Instill number of drops in one nares and then into the other. Protect dropper with a piece of soft tubing if patient is an infant or young child. Avoid touching nostril with dropper. Breathing through the mouth helps prevent aspiration of solution, and the soft tubing will protect the patient's nares from injury during administration of medication. Touching the nares may cause the patient to sneeze and will contaminate the dropper. After that, have patient remain in position with head tilted back for a few minutes because tilting the head back prevents the escape of the medication. Next is to perform hand hygiene because hand hygiene always deterrs the spread of microorganisms. After performing hand hygiene, assist the patient a comfortable position because this always ensures the patient's comfort. After that, evaluate patient's response to the procedure and medication because the patient needs to be evaluated for any adverse effects from the medication or procedures.